I have experiences and also people during my training and development that have steered me towards a career in research. During my training in surgical oncology as an intern, it was a very difficult experience because you saw a lot of patients coming in with stage 4 cancers when nothing could be done for them. And that was, for me, that was very tough to see.
The moment that brought me to science was slow to arrive. And when I was in high school and junior high, my mother would force me to go to these women in science sessions. And I would always roll my eyes and wonder why I had to do that. And it took me a long time to realize then that when I started to study psychology that I was becoming a scientist.
Cancer is very expensive to treat. It leads to loss of quality of life. So our goal in our division is to, as much as possible, work towards preventing cancer before they occur.
The Prevention and Control Program, we work in prevention of cancer and reducing risk. We work in early detection and making sure people get their cancer detected as early as possible when we can treat it better. And we also work in survival and making sure people have quality of life during and after treatment and taking care of the whole community.
My work on breast cancer looks at investigating the molecular determinants of mammographic density and breast cancer in young women. 25% of breast cancer cases in women is in premenopausal women. So my research over the last 6-7 years has focused on identifying molecules that can be targeted and how we can then design targets to prevent this.
A lot of our research starts with talking to people and understanding their perspective, understanding what they're already doing for their health and where they're struggling and where they're succeeding, and building on those strengths and building on that motivation people already have. In years of research on cancer screening, we always heard that cost was an issue. Cost is a problem. And it was this aha moment of, well, we need to think more carefully about this because people are trying to make the best decisions they can about their health under limited resources. And so we went and we wrote a grant and got funded to really look at how people decided which medications or which healthcare tests to pay for and which they just had to wait on because they didn't have the money. The strength of prevention and control is really that we go from identifying the factor to intervening on it, all the way into making sure it gets into the population.
I spend a lot of time with family traveling. I love soccer and I also love cricket, so I watch a lot of cricket. I try to find time to just take things easy.
I love to garden. I have a garden and it was a pollinator garden before that was a thing, with plants that attract bees and butterflies and spending time outside. Take care of myself at the same time as recharging and relaxing, getting that fresh air and that physical activity.
I think it's wonderful that Siteman has been given an exceptional rating again, and that's a testament to the wonderful collegial transdisciplinary work going on here.
I think it's really unique how well we work together. The community at Siteman, the community of researchers and physicians and staff and healthcare providers who are all working together and supporting each other.
It's a great honor to be here because this is a wonderful place that provides support for its researchers, that provides the things we need to do our work well. People want to collaborate to solve problems, not compete to solve problems.
There are ways we can reduce our risk. There are ways we can detect cancer earlier and have better outcomes. And a lot of times people don't know all that information. The prevention and control research, I think, really resonates with people and hits home to help them know there's things we can do to reduce our risk and to live healthier.
We appreciate the work and the contribution that our study participants put into participating in research, because without their participation, everything we do would not be possible.